So first of all, can you introduce yourself for the coaches in Taiwan?
Yeah, my name's Devan McConnell. I'm the high performance director for the Arizona Coyotes, which is an ice hockey team in the National Hockey League. I've been a part of this organization for about 3 seasons. Prior to that, I worked for another team in the NHL called the New Jersey Devils. And before that, I worked in the U.S. collegiate system in the NCAA.
Cool. So, uh, since you work like most of the time you work with hockey players, is there certain physical demand for being a pro hockey player?
Yeah, so hockey's a really unique sport physiologically. If you're not, if player or if people aren't super familiar with it, where you're at, it's one of the fastest team sports on the planet. Players skate at over 20 miles an hour. They typically work at high intensity sort of interval bouts. So players will be on the ice for 30 to 45 seconds, kind of all out, and then they line change out, and new players come on. So in any given period, a player might have between 7 and 10 45-second shifts that are all, usually from a heart rate perspective, over 90% max heart rate. It's it's a sport that's very technique and finesse based, but it's also very physical and aggressive. So it's a pretty unique sport, especially when it comes to the demands physiologically and how we think about strength and conditioning and performance development.
So, since it's very unique, is the strength training or performance training gonna be different with let's say football or basketball?
Yeah, it's probably a little bit in the middle between those two sports. It's not quite as alactic aerobic as American football, which would be 5 to 10 second efforts interspersed with 30 seconds to a minute rest. At the same time, it's not as continuous as basketball, right? Because it's 30 to 45-second all out shifts, followed by usually 2 to 3 minutes of rest. So the biological demands are somewhere kind of in the middle between the two sports. It's physical like American football from the standpoint of collisions and body contact, body checking. At the professional level, players can fight, so there's a interesting sort of dynamic that way. But it's also very very skill based like basketball would be as well. So it kind of sits in between those two sports from a physiological perspective.
Cool. So, when programming for let's say energy system, how would you program it?
Yeah, so energy systems are interesting with hockey, again, sort of sitting in the middle. All three dominant energy systems are important for different reasons and at different points in time. Certainly the anaerobic energy system is the dominant energy producer during those 45-second shifts that players operate in. At the same time, those shifts are often interspersed with 3 to 5 second explosive efforts, followed by 5 to 8 second sort of glides or lower intensity efforts. So there's an alactic power component to it. And at the same time as well, the aerobic system is really important from the standpoint of being able to recover from those shifts. So the aerobic system isn't necessarily producing a large amount of the power for the athlete in ice hockey, but it's really important to be able to recover from the anaerobic bouts that the players go through over and over.
Cool. So since it's in season right now, and I know you guys season it's very hectic. It's kind of 3 or 4 games a week, right? So
Yeah,
since
exactly.
so since there's a lot of game during the week, how exactly do you program the strength training during the season?
Yeah, it's a really good question. At the NHL level, it's difficult. It's very much like the NBA. We play almost every other night over the course of the season. Like you said, 3 to 4 games per week on average. Our approach here in Arizona is, what we call a microdosing approach. So we will do something from a training perspective almost every day. we kind of classify our training into 4 different categories. So we have our force or strength emphasis training days. Those are typically performed post game. So after games, we'll usually do our heaviest lift. We'll have a speed power type of lift, and those are usually done the day before a game. We'll have what we call a structural lift, which is a lot of sort of core balance, higher volume, sort of hypertrophy-ish type of work. Those would be done either post-game or if we have 2 days of practice before a game. And then we have recovery days where obviously if we're playing a back-to-back the first night, we might do a recovery session. So, we are typically doing something almost every single day, whether it be post-game strength development, day before a game, speed and power development, or structural work that helps to keep the body aligned and keep the players as healthy as possible.
So basically they have to like do the strength training like not really strength training, but they need to be at the gym like every day. So is that going to be like is that like exhausting, or like how long would the session be like? And since it's every day, how to make sure they're not overtraining?
Yeah, another great question. We follow a very, very low volume approach because we are, essentially training every day and we're competing every other day. So a given training session might only consist of, 3 to 4 exercises, two to 3 sets, 3 to 5 reps. For instance, our post-game strength training lift that we might have tonight after our game might consist of 2 sets of trap bar deadlift, 2 sets of chin-ups, and 2 sets of dumbbell bench press, all for maybe 3 reps. So pretty low volume, relatively high intensity. At the same time, our speed power work, usually that's done on like I said, a practice day before a game, and usually as part of our warm-up. So the players will still warm up for practice and for games every day. So our speed power work would be, basically the end portion of our dynamic warm-up. And that might consist of, again, maybe 2 sets of plyometrics, 2 sets of medicine ball throws, and 2 sets of, loaded jumps or something along those lines for power and speed development. So it's a very low volume of work. But again, it's this idea of micro dosing. So we do little bits kind of continuously all the time.
So, do you do like any or do you use like any kind of like technology to like monitor the fatigue, or there's like a questionnaire, that kind of stuff?
Yeah, we do a lot in the kind of the sports science area. From a readiness and monitoring perspective. We don't do any subjective questionnaires here, but we use force plates. We use velocity, gym aware velocity tools in the weight room. We use some equipment from a company called 1080 Sprint, 1080 Motion. So we utilize that. So we use quite a bit of technology, external load monitoring. So GPS type tools, as well as heart rate to monitor internal load. So we use a lot of tools to help track the athletes, understand what they're doing well, what they're not doing well, where their fatigue and readiness is, and so that we can help push when we need to push and back off when we need to back off.
So kind of want to dive a little bit deeper into the technology. When you guys like use force plates and like 1080 Sprint, is there like any certain, like, let's say, is it the same with, let's say, like basketball? You guys use like counter movement jump to like assess their fatigue, and like what kind of like what is there a certain metric you're gonna like look into?
Yeah, so that's exactly what we do on our force plates. We look at primarily counter movement jumps. We'll do them 1 to 2 times a week, usually as part of our training. Again, they kind of fall into the speed power day. So whenever we have that day on the schedule, we'll be doing counter movement jumps on the force plates. And we use that information in a bunch of ways. From a long-term development perspective, we look at metrics like relative force output, peak power output, things like that, breaking force, to identify where our players are, where their strengths and weaknesses are, and that information will help us in programming so that we can tailor things on an individual basis based on what the individual needs. From a readiness perspective, we look at things like time to take off, braking phase duration, takeoff velocity, things that tell us a little bit more about how they're performing neuromuscularly. So are they moving the same way that they normally move? Are they moving at the same speeds that they normally move? So we'll use that information on more of a day-to-day basis from a readiness perspective. And we also look a lot at left-right asymmetry to try to red flag potential injury concerns, minimize the incidence of injury, and certainly in the return to play process, this information becomes very valuable as we bring back players back from injury to make sure that they're getting back to baseline and back to where they were when they were healthy.
So kind of want to go back to the thing you mentioned that you guys do like training like every day. So I know in like American football, they're probably gonna do like Thursday or Wednesday, and in the NBA, they're probably gonna do like game day lift, no matter it's like pre-game or post-game. So for you guys, you do every day. Is it some kind of like cultural things, or like why instead of like, because it's a crazy schedule, so why do instead of like just only put in the game day lift, why do you guys like you use it in like every single day?
Yeah, we find that from a fatigue management standpoint, we have better success with small doses of stimulus more consistently applied rather than larger doses or longer training sessions less frequently. So if we were only training, if we were only applying stress to the athlete post game, the reality is it would be 3 to 4 times a week, but we probably wouldn't get a very beneficial speed and power stimulus because it would be post game when the player is fatigued. We can still develop or maintain strength output in the presence of fatigue, but it's a lot harder from a speed and power development standpoint. So by sprinkling some of that stuff in on practice days before practice when the players are a little fresher, we think that we're able to influence those characteristics a little better. So again, it ends up being about the same amount of total work over the course of a week as if you had somewhat higher workloads or longer training sessions just post game. But we sprinkle things in almost on a daily basis to continuously apply that stress.
Cool. So next thing I want to discuss is like speed training for hockey, because on like when we train like track guys or like American football, speed is like exactly like linear, but when it comes to like hockey, there's a little bit of, can I understand it this way? It's a little bit of the side push, a little bit instead of only like sagittal plane, there's probably a little bit more of the sagittal plane, but yeah, frontal plane, that kind of stuff.
Yeah, absolutely. Especially at higher speeds at near max velocity.
Yeah.
The skating stride has it's not actually frontal plane, it's more transverse plane, but it's certainly a side to side motion. But the acceleration pattern over the first 5 to 10 meters on ice is very, very similar to what you would see a land-based athlete or a track athlete look like. So we're looking for the same types of shapes and patterns. I know that you've had Boo on here before talking about speed development from his perspective as a track coach, and a lot of what we'll look at from a speed development standpoint is really about acceleration. We do try to influence max velocity, but much more important in ice hockey is acceleration, because the game is played over very much smaller area. So a lot of the mechanics that you would see or that you would coach a team sport athlete on land or even a track athlete from an acceleration perspective are very, very similar. But that being said, it is a different biomechanical movement at higher speeds. So definitely those are things that we pay attention to from an injury management standpoint and also from a technique standpoint.
So do you also like microdosing like sprinting during the season, or it's only for off season?
Yeah, we do. We actually use our 1080 sprint on the ice once or twice a week when we have access, when we have a practice schedule that allows for it. And again, very small amounts. It might be 2 to 3 sets of 10-meter sprints with 10 to 15 kilograms, depending on where the athlete is kind of profiled. So it's just small amounts, small touches. We spend a lot more time on it in the off season, obviously, but it is something that microdosing approach comes back, and we do little bits of it as often as possible.
So you mentioned you're probably gonna skate or do speed training on ice. Do you gonna let them sprint on like land during the season, or only for off season?
Yeah, we sprint on land. That's very common in ice hockey. As part of our warm-ups, part of our training. It's pretty typical to do that. Short distances, we don't do, our weight room is fairly small, so nobody's doing more than 5 to 10 meters. And it's not super high intensity work. It's more patterning and things like that. But we'll get a few reps of short sprints in, again, on land and on the ice several times a week. We also work hand in hand with our coaching staff to make sure that the speeds that players are actually achieving in practice, just within the practice plan, are if we're touching above 90% a couple times a week in practice, those are things that we look at. So we try to sprinkle those things in and help have the coaching staff build drills that help to influence those things.
Cool. So I know in ice hockey, there's gonna be a lot of like because they have to shoot the goal, so there's gonna be a lot of like high speed rotational work. So how exactly do you like program these kind of like training, and how to like minimize the injury chances? Because it's basically like asymmetry, right?
Yeah, there's certainly always going to be some asymmetry inherent with hockey players or any rotational based athlete that primarily rotates one direction. So I think from an injury preventative standpoint, I think that's where a lot of our structural training comes into play to try to minimize or reduce any gross asymmetries, knowing that you're never going to eliminate those things altogether. From a rotational power standpoint, nothing super fancy. We do a lot of med ball throws and things like that. Both directions, I think, is important to try to minimize some of that, but still develop some of that power output. But it really comes down to understanding functional anatomy, and whether it's a hockey player, a soccer player, basketball player, the human body works the way the human body works, and so we try to keep that in mind when we're programming our athletes. We do a lot of unilateral work. We do a lot of contralateral upper and lower body combined type work to try to maintain fascial sling integrity and things like that to minimize those issues.
So can you like give us an example? Like how was the core training session gonna be look like? Like so is like some exercise you're gonna do, and how many the exercises you're probably gonna program it?
Yeah, we're not going to have necessarily a separate session that is core training, but we're always going to have quote unquote core exercises sort of built into any of those types of training days. On the more strength based days, so post game lifts, we're going to focus more on core stability. So things like anterior core rollouts or ball rollouts to maintain pelvic control. And anti-extension work, Palloff presses or anti-rotation presses, chops and lifts, those types of things to create and maintain motor control and stability through the trunk. And then on structural days, we'll have more movement-based core work that might be more dynamic in nature. So whether that's those might be medicine ball type work, or again, chops and lifts, more dynamic based. So we're integrating different types of core training into our bigger picture training program.
Cool. So, is there like any common injury you see when you train like ice hockey players, and how would you deal with that?
Yeah. So hip flexor, groin, lower abdominal injuries, sports hernias are really common in ice hockey. So again, a lot of what we talked about, just what we consider good training, core stability, thoracic rotation, hip mobility, unilateral lower body strength, all of these things to me go into the bigger bucket of injury preventative work, especially for that sort of hip core growing area. So those are things that we're continuously, working on and utilizing and always touching upon. Other types of injuries that are pretty common, shoulder, AC separation, sprain type injuries, because it's such a high-paced collision-based sport. There's less specific work that we do to prevent those things because they're more contact-based, but having sort of a robust and fairly well-balanced upper body pushing and pulling strength, I think, is really key to those things. So those are some of the things that are common injuries in ice hockey that we try to work around.
Cool. So I noticed that in American football, there's probably going to be a 40-yard dash they're going to be looking into, and like basketball, there's like jumping ability or like jump heights they're going to look into. So for ice hockey, is there like certain like test or like certain metric you guys gonna determine the player's physical ability to be a great player?
Yeah, I mean, you named two of them right there that we utilize. We talked about counter movement jumps, utilizing force plates for us, but that's certainly a big component. We think that lower body explosiveness is measured by vertical jumping, is really well correlated to skating speed, especially acceleration. So vertical jump is really important in ice hockey. We do 40-meter sprint on the ice in our testing battery, and we do force velocity profiles based on that. And we look at 5-meter, 10-meter, and then the full 40-meter sprint time, and utilize that. Again, speed being such a key component to ice hockey. That's really important. We do what we call a hot lap or a flying lap. So basically, we have timing gates set up from blue line to blue line on one side of the ice, and the player starts on the opposite side, and they skate all the way around the rink so they can get up to full speed. And we measure them and their top speed through that blue line to blue line kind of flying 10 idea to measure max velocity. We also utilize a lower body strength test. We do a lot of rear foot elevated split squats. So we'll do a force velocity profile with the gym wear with the rear foot elevated split squat to identify strength and help utilize that to profile where the player is, to decide if they need to work more on strength or power from a lower body perspective. And we'll do the same thing with upper body strength, simple bench press, same idea, utilizing the gym wear to identify an estimated 1 RM for that. And we'll sprinkle in some other tests and assessments like isometric belt squat to measure peak force output, and land-based sprinting and resisted sprinting as more of a continuous monitoring checkpoint, especially in the off season.
So, these movement or like these exercises you're gonna do as a test or as a training, is there like a certain test day you're gonna do all these tests, or is it like what we mentioned, it's a microdosing thing, it's also training and it's also like testing?
Yeah, I'm a big fan of the idea of tests being part of training. So it's a continuous thing, and a lot of our technology allows us to accumulate that information. But in the National Hockey League, we do have a couple of time points where we have specific testing days. We have what's called development camp in the NHL, which is basically our players that we've just drafted or have recently drafted, or young players that we're interested in, we can invite to development camp, and we'll typically do an abbreviated version of that testing battery on 1 or 2 of the days. And then we have our main training camp for the NHL team, which is kind of the same process. And that's league mandated, can only be done on one specific day. So we have to be pretty concise with our testing battery to get as much of that in as we can. But again, once we have our team, we're testing a lot of those things continuously throughout the year.
Cool. So, I personally trained some of the ice hockey national team athletes in Taiwan, and to be honest, when I like let them know that I'm gonna do a podcast with you, they're very excited.
That's awesome.
Here's a question from those guys. So for like for your perspective, is like we just mentioned acceleration, like pure linear acceleration, like for the 10 meter, as like the training volume and the max velocity, like side to side on the skate. Like how would you like let's say program the ratio between it? Which one is more important? Or how do you like decide which day you're gonna do like linear work and which day you're gonna do like a lateral work?
Yeah, that's a great question. So in the off season, we basically will have a 4-day training week, and 2 of those days we will emphasize lateral based work, so more change of direction, agility, that type of stuff. And then 2 of those days we will have more linear based, speed development work. We'll progress distances over the course of the off season from, basically from short to long, with track terminology. So we'll start with very short distance sprints, and as the course of the season or the off season progresses, we'll extend those, and that's both on and off the ice, and we'll do those concurrently. And then our lateral based days, it's the same kind of thing. We progress from very low intensity, eccentrically focused work where it's really about being able to stop and control lateral motion on one leg, and we'll progress those things over the course of the off season to be much more dynamic, and then ultimately progress those things to be in combination with linear work. So we might finish the off season with doing something like a 5-10-5 agility, where we're still working on change of direction left and right and stopping and starting, but we're also working on transitioning to do linear work.
Cool. So I noticed that some of the, or probably a lot of like strength coaches, when they kind of like train no matter it's like hockey player or other kinds of like pro athlete, they're gonna use a lot of like bilateral strength training instead of like unilateral strength training. And can you like talk a little about your thoughts on bilateral strength training and unilateral strength training?
Yeah, we do very little bilateral strength work. We trap our deadlift 1 day a week for part of the off season. We have some players in season that like to do some of that stuff, and so that's part of the reality of working at the NHL level. Is there's some flexibility that if the player wants to do something a certain way, then we try to accommodate. But from a philosophical standpoint, most of what we do from a lower body strength development standpoint is unilateral, or at least split stance type work, like the rear foot elevated split squat. We do a lot of true single leg squats, skater squats. I think, I think from a structural perspective, from an injury reduction standpoint, anytime you're standing on one leg instead of two, all of the stabilizers of that limb come into play. It really becomes, as soon as you stand on one leg, the whatever motion you're going through, whether it be a single leg squat or a single leg deadlift, it's really a triplanar, multi-directional exercise, because you have to stabilize in 3 dimensions versus on 2 legs where you don't necessarily have to do that. But I also think, most of sport is performed on one leg at a time. So I think it makes a lot of sense to develop strength and stability on single limbs. And then when you take into account the idea of bilateral deficit, that you can actually get stronger on each leg individually versus both legs together. And we've seen that to a really, really high degree, especially when I worked in the collegiate setting, where a lot more of the year was dedicated to strength and conditioning. We routinely had athletes that were able to rear foot elevated split squat between 400 and 500 pounds without any issue, and they'd not be able to do that type of load or anything near that bilaterally. So you can get a lot stronger on one leg at a time. It's something that is becoming more well understood, I think, but it's still a little bit of an outside the box concept, but it's certainly something that we've utilized for a long time and believe strongly in.
Can you like uh explain a little bit about the concept of like bilateral deficit you just mentioned?
Yeah, I mean, essentially the human body is not designed to do anything propulsively on two legs. If you think about almost any sport, there's nothing that happens from a locomotion standpoint or a movement standpoint on two legs at a time. Some athletes will jump, basketball players, volleyball players, there's some jumping that certainly occurs sometimes on two legs, but if you really break down biomechanically, look at those things, a lot more of the action is typically happening, more one leg to the other. And regardless, that's more from a power standpoint, which we'll still do bilateral power work. We'll do, double leg plyometrics and loaded jumps and things like that. I think there's still a lot of benefit there. But from a strength standpoint and a propulsive standpoint, not much happens in real life on two legs. So the nervous system is really designed to operate unilaterally to move the human body around. So the idea of bilateral deficit basically states that whatever you're, in theory, whatever you're able to, whatever strength level you're able to produce on two legs. Let's say you could squat 100 pounds or let's call it kilos, 100 kilograms with a back squat. The original thought process, well, that's two legs. So each leg is contributing 50% of that work. So if you did a single leg squat, at best, you'd be able to single leg squat 50 kilograms. But what the research and in applied practices has shown us over a long time is that you can actually produce much more force on each leg individually to account for more than that 100 kilograms. So each leg individually might be able to produce or squat theoretically 60 kilograms for a total load of 120 kilograms. So that's the basic premise of the bilateral deficit. There's been a lot of work done in this area as well. Mike Boyle, who's a good friend of mine, has been a big proponent of unilateral work for a long time. Alex Natera is a strength coach, I believe out of Australia, works with rugby and has done a lot of really in-depth research, not just practical application, but work with force plates on unilateral training and has really shown the benefit of that. So that's kind of the nuts and bolts of the bilateral deficit and why we sort of emphasize unilateral training so much.
Yeah, and there's like coaches and athletes gonna like single leg squat heavier than bilateral squat. It's crazy right now.
Yeah, I mean that's what we've seen is when our athletes have gotten really, really proficient in the rear foot elevated split squat using a safety squat bar. Again, routinely had athletes that could RFE over 500 pounds, and they would not have been able to back squat or safety bar squat 500 pounds. And part of the reason for that is from a squatting perspective, as a specific exercise, the weak link in the kinetic chain is almost always the lumbar spine, is the back. So if you picture an athlete, trying to perform a 1 rep max back squat or front squat or any kind of bilateral version, if they're not able to complete the exercise, they fail the lift, it's almost always a failure at the low back. It's not the legs. It's not that the legs can't produce that much force. It's that the low back can't sustain that much load. So when we're talking about trying to develop lower body strength, we want to take the weak link out of the equation as much as possible. So that's a whole nother reason for the unilateral strength development.
Cool. So, but I'm gonna ask another question about, because like American football or like hockey, it's a collision sport. So how exactly do you make sure the spinal region or the core is strong enough to be able to take the hit?
Yeah. Again, I think, it's a combination of everything that we've talked about. It's not that we're not doing core stability work. It's not that we're not doing, upper and lower body strength work. I think it'd be hard to argue that somebody that's split squatting, 350 pounds routinely is not developing, specific spinal, and core strength and spinal erector strength and the type of hypertrophy and mass that's necessary to be able to withstand those collisions. So it's a broad question. There's not just one thing that contributes. I think it's a larger picture of the program as a whole, but all of these pieces kind of fall into place and help to build that up.
Cool. Appreciate it. So last question before I let you go, okay? I know you work with like different organization and you came from like the college setting to a pro setting. So from college to like pro setting, like what's the difference between these two like different at an NBA NCAA and a pro setting, and how like or what are the demands to be a performance coach at a pro setting?
Yeah. From a sports standpoint, I mean, at the NHL level, it's just so much the skill level, the ability of the players at this level. It's the best 700 human beings in the world that play this sport. The level of skill is just astounding at this level. The college game is very good. Is anybody that's able to play college hockey, collegiate hockey is an extremely good hockey player as well. But it's 10 levels above that at the NHL level. The speed is it's faster, it's quicker, everything happens. It's just sharper at the professional level. But probably the biggest difference, honestly, between the two levels is the schedule. In collegiate ice hockey, almost all the games are Friday, Saturday night. So you basically have Monday through Thursday to practice. You play Friday, Saturday, and you typically have a rest day on Sunday. So there's a lot more strength and conditioning that can happen. You can spend a lot more time in season focused on training and physical development and player development. At the NHL level is much more about optimization because you play almost every other day. So it's much less about development. It's much more about optimizing. So those are the biggest differences between the kind of the levels. I would say, what does it kind of take to be able to work at this level, to become a performance coach at the NHL level? I mean, certainly you need to have a great understanding of anatomy, physiology, biomechanics, all of the things that would come along with a master's level or higher academic degree. But really it's just coaching like any other sport. It comes back to relationships. It comes back to communication. If the athletes don't trust you, they're not going to listen to you. They're not going to do what you want. And that's really important at the pro level where, quite frankly, they don't have to do anything we ask them to do. So if they don't trust me, if they don't buy into what we're doing, they're not going to do what I need them to do. And if they're not going to do what I need them to do, then I'm probably not going to have a job for very long. So it comes back to those key relationships.
Yeah. So if there's like coaches or like therapists are interested in what we're talking about today, where can they reach out to you?
Yeah, you can reach me on I'm on social media. I'm on Twitter and Instagram. Both of them are at D McConnell 29. Just my name. I do have a book if anybody's interested in sports science and how to apply sports science in the team setting. It's called Intent, Applied Sports Science for Practical Development, and at least in North America, that can be found on Amazon. So you can find that under my name. And again, the name of the book is Intent.
I'm gonna put the Amazon link on the podcast down below.
Awesome.
Okay.
Great.
Appreciate it, man. Appreciate it.